Hello and welcome to all who are joining us. I'm pleased to introduce Dr. Ethan Handler of Advent Cosmetic Surgery Center. Dr. Handler is a dual board certified cosmetic surgeon at our Wauwatosa location, and we'll be discussing Botox and facial fillers this morning, answering your questions live. Before we get into taking questions from viewers, I wanted to ask you, Dr. Handler, to kick us off, can you describe the difference between Botox and facial fillers?
Hi all, thank you for joining us for our first Facebook live stream from our Cosmetic Center here at Advent. Thank you, Megan. And good first question to start us off. So what is the difference between Botox and filler? And Botox is an injectable that's used to actually weaken muscle so that you can't make that real active motion and create those wrinkles. So think of it as it just kind of relaxes that muscular contraction so that you're not creating all that squinting or wrinkles in the forehead. When it comes to filler, filler is used to fill actually the kind of static wrinkles that are in the, around the nose and forehead and that sort of thing. And so when you're at rest and those wrinkles that you see, that's what the filler is used for. And
just so the viewers know, how long do these treatments last on average?
Good question. So when it comes to the Botox injections, that's typically done on every 3 to 4 month cycle. Some patients get a little bit of the longer end, some patients a little shorter end. What you do find though is when you have recurrent injectables such as Botox is that if you stick with a good regimen over time, you might find that the duration of effect actually lasts a little bit longer. So maybe you stretch it into like 6 months or so. When it comes to the filler, it depends a little bit on which product you use. Now here at Advent we use mainly allergen products, so we're talking Volbella, which is used for lips, that lasts anywhere from a year to 2 years. Voluma, which is for the mid-face rejuvenation, that's FDA approved for 2 years. And then Juvederm is anywhere from 6 to 9 months. And you might ask yourself, well, why wouldn't I just want the 2-year product? Well, they're made differently and they do different things, so it kind of depends on what you need and what would best serve your face.
Wonderful. We are taking questions live, so if anybody who's watching has a question, feel free to type that in the comments field. Otherwise, we did receive a few emails with questions prior to taping today.
Great.
So Dr. Handler, one patient asks, it seems I've lost a lot of volume in my cheeks and lips as I've aged. Is there anything I can do to prevent or correct this?
That's a great question, and that is a common question and unfortunately something that happens to all of us as we get older. So it's not as much sagging as it is that we lose volume. And so a lot of the fillers are great for restoring volume. So as far as non-surgical options go, for example, I mentioned before, Voluma, great for mid-face rejuvenation, kind of creating that more heart-shaped face, helping to lift by adding volume. And so those are the products that are used to really restore volume in the face, cheeks, temples, that area. And those are the non-surgical options. Otherwise, facial fat grafting, where we steal fat from one part of your body, inject it into the face to kind of give volume back, are other options.
Perfect. Another person asked, I've been self-conscious about my double chin my whole life. Is there any way I can treat this without surgery? If so, what should I expect after, and how many treatments will I need?
Another good question. So a lot of press has been about this new product called Kybella. It's a new FDA-approved injectable, also carried by Allergan in products that we use here. And that is where you will come in and have an assessment done by us. Injectables put underneath the chin, kind of in that submental area where that fat likes to kind of hang out, and that's usually spread out over 2 or 3 treatments, anywhere from 6 to 8 weeks apart. The injectable itself might take 15-20 minutes. You have some discomfort for about a week, a little bit of swelling, which then mellows out after that period of time, and then we get you back in for your second, possibly even third treatment, depending on your treatment plan. About 6 to 8 weeks separated apart. And what that does is it actually causes the fat cells underneath the chin to break down and go away. And we're born with a limited number of fat cells, and so those fat cells there, they just don't come back, and so it helps really contour the neck.
And how many, as far as the treatments go, would you be able to know that at your initial consultation, or do you kind of have patients go have a treatment, have 2 treatments, and continue to analyze after each?
Yeah, I mean, you can always reassess. You know, obviously when you come in for your initial consultation, we try to come up with a plan and a care plan that's best for you. If we need to make adjustments or reassess during that plan, we can certainly do that. But, you know, on average 2 to 3 treatments is enough spread out over those 6 to 8 weeks in between treatments to hopefully achieve the look and desire that you're looking for.
So we've been talking a lot about consultations here in Advent.
Mm-hmm.
We had somebody ask, what's the advantage of going to Advent for cosmetic treatments?
That's a good question, because obviously, you know, if you Google Botox or filler and, you know, gazillions of websites show up and offices show up in the area of people that do this, and that's the truth. There's lots of people who can do injectables and filler, and I think what separates us here from Advent is that we've built a reputation over, you know, the past decade plus of really establishing, you know, trust with our patients, unparalleled, you know, care with our patients. You know, the expertise is there behind, you know, that service. Myself being dual board certified, and then on the east side of Milwaukee and Mequon, Dr. Jim Rossiter, who is also a facial plastic surgeon, board certified head and neck surgeon, as well as even our advanced practice, you know, providers that are here, trained by us, understanding what we need to be doing. And so it's you come here for the service, but you get the expertise and the unparalleled, you know, customer service and patient care.
Another question that we had, I've heard a lot about preventative Botox. Are there any benefits to this, and is there truth in it being preventative?
Sure. So that's the concept of, hey, should I start Botox, let's say when I'm 20, before I see any wrinkles, and then it'll prevent me from ever getting wrinkles. There is truth to that, and there is parts of that definitely make sense, and it's because wrinkles are created by facial expression and, you know, basically an active face. And so, you know, people might notice that when they're, you know, sitting at the computer working all day long, they kind of furrow their brow and things like that. And so for people that might notice that some of those lines are becoming a little bit more prominent, that's where preventative kind of maintenance can come into play and weaken that contraction so they're not creating the deeper wrinkles later on down the road. You know, in addition to that, you know, there's sunscreen and other facial products that help prevent that, but the Botox itself really weakens that muscle, so you're not making this strong contraction.
So in regards to Botox and facial fillers, it seems that in the press there's a lot of women receiving these treatments, and we had a question come in, do men receive these treatments as well?
Sure, good question. Yes, I mean, I think overwhelmingly it's both sexes, you know, men and women definitely get Botox. I think, you know, in the media you see more women getting it done, but you know, both men and women get this done. It's I think Botox is one of the you know, greatest kind of inventions and discoveries as far as, you know, basic facial care, because one of the wonderful things is that it's not permanent. If something, you know, wasn't quite right, it wears off at the same time. It's something that can be done where patients don't feel like they have to have a surgery to have an effect. And it doesn't take much time. You come in, consultation, but then for the touch-up visits, you know, it's popping in and out, and it doesn't really affect their lives for weeks on end.
We did have a few questions come in live, so we'll jump over to that now.
Perfect.
From Sandy, she asked, is there a treatment for the puffy eye area?
That's a very good question. So the puffy eye area can be a little bit challenging because a lot of times what ends up happening is you get almost some venous congestion. You lay down at night, gravity's not working in your favor, and so you can get some of that puffiness. You know, there are certain things, eye creams especially, when it comes to eye puffiness, you know, most of the active ingredient is caffeine. It can help kind of decrease some of that puffiness. You know, obviously good sleep habits, that sort of thing can also help. Oftentimes too is that when people lose volume in their cheeks, they will notice the puffiness up above their eyes more because there's less volume here. So oftentimes what's done with filler is masking that puffiness by adding volume back into the cheek so that it looks like a nice smooth contour. So that puffiness sometimes is unmasked as we get older, and really it's about adding volume back into the cheeks to kind of cover that back up.
Thanks, Sandy. Wonderful question. We had another one come in from Sandy as well. Are there treatments for the neck area, specifically to treat the chicken neck, the area below the double chin area?
So, I mean, if that's kind of more of that like turkey waddle, loose skin thing, there's not, I'd say, a great non-invasive treatment at this point in time to really tighten that skin. I think some of the effects that are noticed with some of these minimally invasive treatments is there is some element of skin tightening, but that's not the main effect of those things. It's really about, decreasing the amount of fat that you have in those areas. So if you really have a lot of loose skin in the neck, as much as I'm a surgeon, so I love to say it, but it's one of those things that really to tighten that skin back up is kind of more of a neck lift or facelift type thing.
Thank you, Sandy. Kathy is asking, how often do you need to get treatments once you've started preventative maintenance?
So again, it's really just the amount of how long it takes for that product to wear off. So again, if you're talking about Botox, 3 to 4 months. Now let's say you waited 6 months or 8 months. That's okay too. It's one of those things that if you really want a strict regimen, 3-4 times a year is ideal, but let's say you can only afford and want to only do twice a year, that's okay too. And still, you still weaken that muscle. Now it still functions, so I don't want to say weaken to scare anybody, but it still works, but you still weaken it. So, anytime that you can come in, have that done, you'll notice the effect. The effect really lasts for about 3 to 4 months.
In the same line, Jamie has asked, how long before fillers wear off?
So again, good question, and it really comes down to which filler you use. Now again, some fillers, such as Juvederm, might be 6 to 9 months of duration, whereas Voluma is FDA approved and says 2 years. Now, there's plus and minus on both of those ends. And so of course the next natural question is, why don't I just use the one that lasts 2 years? And that would be great, but the reality is that each of those products kind of have their niche areas that they're best used for, and have different properties about the filler that, do lifting versus filling versus, just different styles. So we have to kind of tailor a plan that's best to you, that makes the best sense for each patient.
So Dr. Handler, when we're talking about these different filler options, it's not really something that the patient needs to worry about saying this is the one I'd like to receive. It's something that we can leave up to you at our consultation.
Right. One of the nice things is that we've gotten more tools in our tool bag essentially, and so because of that and the different fillers and the different styles that those fillers do, we can then tailor a treatment that's specific for you. Let's say you come in, you want some lip enhancement, you want some mid-face enhancement, and you want the nasolabial folds. Well, that's potentially 3 different types of filler products that are best served for each of those areas. So everybody's a little bit, different and unique, and that's what makes, us all wonderful individual people. And so it's a matter of coming in and letting us kind of assess and talking with each patient about what their goals are, and how best we can meet those goals.
We had a few more jump on watching us live, and a question came with that. Larry asked, do your treatments benefit men? Maybe we can chat about if there's any in particular that men seem to be most fond of or happiest with the results.
Yeah, I'd say overall, and I guess every practice is a little bit different as far as, male versus female demographic and what they see, but I think, in general, men might seek more, Botox, let's say, treatments, more for wrinkles and wanting to look less aged. The facial volume issues, certainly men get filler, and that's totally normal and part of what we see, but I think Botox might be maybe the more popular choice among men. Doesn't necessarily mean that that's the only thing they can do, but that's what I'd say I see more commonly.
And do you say it's the same amount of time, men and women, 3 to 6 months for Botox?
Correct. Botox, again, 3 to 4 months.
Mm-hmm.
What you find with men, though, is that the amount of units that you need, or the amount of, dose, let's say, of Botox might be more, and it's just because they typically have a little bit stronger of contractions. So again, it's about trying to weaken that muscular contraction. So let's say patient A and B, male, female, let's say you target the frown lines, you might have to use a little bit more product on the man versus the woman to get the same effect.
Perfect. We had another question come in. Kathy's asking, there are so many people out there that are offering Botox and fillers. How do you go about picking a clinic or a doctor, particularly that's safe?
That's a great question. So, one thing that it comes down to, now of course I'm biased because I trained as a surgeon, so I have kind of a different mentality, but part of my training was learning all about the anatomy of the face and understanding the mechanics of that anatomy, and certainly I think that expertise is an important part as like step number one as to what you're looking for. How is this doctor trained? And what do they focus on? And then number two, making sure it's a safe environment, things are done in a sterile fashion. But then on top of that, because lots of people have that baseline expertise, how do you pick between 20 different clinics, let's say in Milwaukee or wherever you are? It really comes down to, I think, then how do you feel as a patient going to that place? How well do you feel like you're heard and served at that place? And do you trust in the care that you're receiving there and feel that it's consistent? And I think that's really what it comes down to, is that, Botox and filler and all these things are like any kind of luxury item, and so people can choose where they want to go. So it's a matter of, do they have a good experience there? Do they feel like they're well taken care of? And do they have the results that they want?
Perfect. We're going to see if any more questions pop in within the next few seconds here. And it looks like no one's jumping on. This has been absolutely so much fun. Big thanks to Dr. Handler for answering all of our questions today, and
Absolutely.
thanks to everyone who checked us out live. Know that we are here for any questions at any time via email, phone, or Facebook. And stay tuned for our next Facebook Live event. We'll see you guys all soon.
Thanks, everybody. Hope to meet everybody soon.